How do you turn this on? Can I walk around with this? Some of you may have seen me fall off the stage just now. Welcome, everybody. I hope you've had your coffee. You're in for a treat today. This is an innovation session. We've got some amazing people in the audience, interestingly. But to kick off, we've got two very special people. It's Professor Shafi Ahmed, who is, and Ali Parsa, who are both entrepreneurs, work on global healthcare stuff. But interestingly, I think what's really special about these two guys is that their vision, the vision to make a difference to people, and the vision to make a difference to everyone's lives. So please, warm welcome for two amazing people who'll have a little conversation about the future of healthcare.
Thank you. Checking, mics are working, that's good. I'll make sure the other one's working. Testing. Thank you. Thank you, Daniel. Thank you. All right, okay. Good morning, everybody. Thanks for coming on our second day for Giant. As you know, Giant's been around now for 8 years since we sat in my office at the Royal London Hospital with Barry to figure out what could be useful to bring a community of innovators together. And then Giant was born back in 2016. This is our 8th year. Thank you very much for supporting us over those 8 years. So I've got the great pleasure today of having a conversation with Ali, who's of course a dear friend, but also someone who I find quite inspiring, and he has a wonderful journey into healthcare. His insights will be unique, and also hopefully we'll all gather some valuable insights from his experiences over the last few years. So first of all, I'm going to really ask Ali about his kind of early kind of life, in a sense, because Ali was born in Iran, and then he came here as a young child as a refugee. Ali, tell us a bit about that initial part of your life to understand where you are today from where you were kind of brought up.
Thank you. And I guess I was born in Iran in a wonderful, lovely family. And it's funny because when you're a refugee and you arrive as a refugee, everybody assumes you must be so downtrodden, so badly done. And you're unlucky because you had to leave your country and it's hard. But we forget that these are just like everybody else, lovely families that brought them up. So I was, and then the Iranian Revolution happened. Sadly, I was on the wrong side of it. And I had to leave when the universities closed. And I'm one of the people that everybody's trying to keep outside our country now, or the refugees who are trying to find their way into a different life. And I arrived in UK. I was incredibly lucky. I think UK was a fantastically hospitable country. I think you and I, Shafi, belong to a generation where racism was a lot more open. But even then, the number of people who receive you, who are kind to you, who help you, always is significantly more than the ones who abuse or say something loud on the street. But I put myself through education, worked as hard as I could. I think you were telling me last night, Shafi, when you very kindly took me to watch your wonderful team.
That the best team.
Yes. You said that your mom and dad told you your job is to work twice as hard as everybody else, right? And that's how we're brought up. You just work harder.
So your career wasn't healthcare first of all, was it? It was completely different to healthcare. Tell us a bit about your early part and what then inspired you to go into healthcare.
So I wanted to be an engineer. It's very funny. When I got entry into Cambridge, I self-taught myself. I sat at home and did my A-levels and O-levels. And somebody in Cambridge liked the fact that I did it in 9 months as opposed to the 2 years it takes, and gave me an offer, and I had an entry into UCL. I didn't have anybody with me who knew about Cambridge or UCL. I called my parents and they said, well, if UCL is in London and all the big universities are in big cities, it must be better than Cambridge. And I think sometimes we forget that what we think that is granted, how our point of reference is so different than everybody else. So I went to UCL, I did a PhD, I'm a failed scientist. I thought I'm gonna be a physicist for the rest of my life. I wasn't very good at it, and I didn't have any money, so I had to pay for my PhD. And I built a business, and I found out I'm actually better at that than I was at being a scientist. So I sold my business when my PhD finished. The investment bankers who sold it for me, per hour of work, made so much more money. And I thought that this is a much better gig than what I'm doing. So I went and became an investment banker for a while. And I think my last job was to help build Goldman Sachs technology M&A business across Europe.
So that was your kind of initial experience, and it kind of makes sense from banking business, from building business, etc. You acquired the skills, if you like, then to come into healthcare. What was the spark for you to say, I'm leaving investment banking to go into something much more profound, I guess, for my future life? What was that spark?
So, so it wasn't. It was really a little bit more. I didn't want to be a banker. It's not that there is anything wrong with banking. I don't subscribe to people saying, oh, banking is bad and healthcare is good. I just think everybody is trying to make a living and everybody is trying to make their contribution and they fall into a career. So that wasn't my thing. My thing was I didn't like doing projects. My father was a builder, my mother was a builder. I liked building things. And banking consultancies, or you do a project, you move to the next one, and you move to the next one. And that just wasn't me. So I left to build a business. I didn't know what business, and I left when my first child was born. And I thought that I want to be a full-time dad, so that's going to be my business, bringing up the child. 6 months of gaga goo, I thought this is the hardest job on the planet. So and at those times, I was doing a series of surgery on my knee, and I looked at the beautiful, supposedly private hospital I was staying in, and I thought that if this is the best London has to offer, is worse than the worst 2-3-star hospital I've ever stayed in. Surely you can make better hospitals than this. And then we got with a group of friends, and I discovered something strange, which was almost every other professional services you look at, whether it's consultancy, law firms, investment banking, the professionals are co-owners or partners of the business. Doctors, outside GPs, are the only section that we thought they actually don't own anything. They're not only that, they're the only group I know that kids who got triple A's in their A-levels are managed by people who barely got a C. Nothing wrong with that, but it's just very strange. So we built the Circle Group, which with the premise that half of the business will belong to the doctors and nurses and the professionals and everybody who works there, and the other half with the people who provides the capital to build it. And as you know, Circle now is the largest hospital group in UK, and just been acquired and is part of one of the largest hospital groups in the world. So that's been a huge success for us.
So that was your first unicorn, right? From zero to building a Circle Health, amazing kind of institutions across the UK, now bought by, I think, Pure Health Group from UAE only earlier this year. That's the Abu Dhabi, essentially, state sovereign government, right? So that was your first forage. You built hospitals, you bought a model of ownership of consultants, which was the first. So they felt they would own a hospital chain or part of the shares, and that invested time and effort, I guess, allowed them to think they also would support you going forward. So next, of course, was Babylon. And of course, a lot's been written about Babylon over the last few years. We've all heard the stories, and I've had endless conversation with you. Tell us a bit about Babylon, and also what happened towards the end. What are your thoughts around Babylon, and what your experience and learning from that was? It'd be great to share that with the audience here.
Of course. I mean, by the way, with the Circle, the reason doctors joined us was never about, I want to co-own the hospital. It was, I want to co-manage the strategy of the hospital. And it's really important. That was a really big difference. But the problem with hospitals is I found that, look, hospitals are just touch. An average person goes to a hospital once every 20 years until towards the end of their lives. And day to day, that's not what touches people. And I thought that a vast majority of people have still no access to healthcare or very little access in healthcare. And yet they all have a mobile phone in their hands. And they're so attached to it that even as we speak, many have it on their hands, right? I thought, what can we do in order to deliver most of the healthcare most people need on the mobile phones they already have? Can we kind of figure that one out? And we started by thinking, well, what would it be if we just put doctors on the other side of the mobile phone so people don't need to go anywhere? And at the time, I remember having a meeting with a group of very learned clinicians in a giant committee meeting, and I physically was laughed out of the room. That cannot happen. What are you talking about? You're telling me that I should see my patients outside the other side. So today, or post-COVID, we all think that is really interesting or is doable. But pre-COVID, or while we came up trying to build this, that was really alien to the way people practiced medicine. But the business grew really well. But that wasn't the only problem, because a doctor behind a mobile phone costs exactly as much as a doctor on the other side. I was listening to you, Umang, the other day, and you were using that expression, which is exactly correct, right? And so for us was, if you want to make healthcare accessible, that's incredibly possible. Put the doctor on the other hand side of the phone, highly accessible. But that doesn't make it any more affordable. To make healthcare affordable, you need to understand what is all the things that a clinician is doing and how much of those things can we do in a cheaper, automated way. And that's how we built Babylon. It was a huge growth story for us until it wasn't. I mean, Babylon grew 400% a year, every single year. I mean, it went from 100 grand to 400,000 to $1 million to 4 million to 20 million. And these are not numbers I'm making up. That's our annual revenue. Then 2018, I think was, or 2019 was 80 million. 2021 was 320 million, then 1.2 billion. And by the time we went into administration was 1.5 billion run rate. And I think it had on its own more revenue than all European health tech companies put together, European and UK held together. So in that respect, it worked really well. But it didn't work at the end because of two reasons, if you want, two buckets. One is the easy answer. You could say, well, why did Babylon go under? It went under because we couldn't raise the money that we needed at our IPO. We went public. The SPAC, which is a special purpose vehicle, which was the rage of taking companies public at the time, was supposed to give us $300 million. No fault of their own, the market completely collapsed. They didn't have that $300 million to give. So we were left in a public market with everybody being able to see our share price, everybody seeing that there's a $300 million gap. And then, of course, the share price publicly is going down. And nobody can invest, because if I come to you and say, can you give us some money, you would say that there is the entire hedge fund community worldwide is shorting SPACs. If I give you $10, it'll be worth $5. So we were kind of almost checkmated. And then we had a debt holder who knew that if it goes to zero, they'll end up owning the business. So they were not making it easy for us to raise money either. So that's the easy answer. And Babylon, by the way, was not the exception. Not a single SPAC company that was of that cohort that couldn't raise his money in the world survived, not one. So that was a structural problem with the way SPACs work. My fault rather than anybody else's, because I was the CEO, I controlled the board, I agreed to the SPAC, I shouldn't have, I lost my baby of 10 years. Everybody else, and I always say that when you're young, and you almost know this about a person, you talk to somebody, when they're young, or immature, they blame everybody else. As you age, you start blaming yourself. But eventually, you find that there is really no one to blame. Everybody does what they can do. Circumstances happen the way it happens. And then I can go through every character in the Babylon story, and they did the right thing by themselves. It's just that at the time, the situation was what the situation was. The harder answer to your question is, what could we have done differently not to need that money? How could we have had better cash flow management? How could we have managed our costs differently? How could we have grown with the capital we had rather than believing the capital will always be there? How could we have had a cash flow model that instead of working for the insurance companies and getting paid on the savings we do, that we get paid up front? All of those learnings, and I can go through them in detail, are things that I will do next time. But if I knew those things before this, then frankly, show me a person who tells you I haven't made a mistake. I show you a person who hasn't done anything.
And hindsight is, of course, great for all of us. We call it looking at the retrospectoscope, almost, in surgery, as a kind of tool for our learning. So thanks for sharing that. And it's important to understand the learnings of Babylon and how we go further forward. Currently, the context of the health systems, we heard from, in fact, I was at the King's Fund when our Prime Minister came with Aradazi for his long-term review and West Streeting, and he said the NHS is broken. Health system is broken, and we know that. I've been in health system for 31 years now. And at least they're acknowledging the problems. Now their whole consensus is the 3 shifts of healthcare, from analog to digital, from the hospital to the community, and of course from treatment to prevention. But we know that's nothing new for any of us who've been in healthcare for a long while. What are your thoughts about the key challenges? Because we had a chat about this before. You did some kind of, you asked many CEOs across the world about what was the key challenge that they were facing in the health system. I'd love to get your thoughts on that.
So, so after Babylon, I obviously I'm completely devastated, and I had lost my father through COVID. My father was among the first people to unfortunately lose his life to COVID in Iran, and my mother calls me, and she says to me, "What are you doing?" I'm saying, "I'm down, Mom," and da. And she said, "I'm so glad your dad is not there to see it." And I said, "Why?" He said, "Your dad was a political prisoner, was in exile, then had to build his own business, then his friends took it away from him, then he did another one, da. So she went through every time things that my dad did and fell. And then said to me, your dad and I went through all of this. And we always used to look at each other and say, it's never about how many times you fall, because that's not your choice. It's about how many times you get up. You have that choice." So I was brought up that way anyways, but I just needed that conversation. And I just make it sound as if I was licking my wound for so long. That was really 2 to 3 weeks after administration of Babylon. And we went in, but Babylon went down in October, and in October, we registered Quadrivia at the end of October, between the beginning. And the thing for us was this, is that the mission continues. Healthcare still needs to be made accessible and affordable for everybody. We just learned so much more on how to do it. So we called many, many friends, colleagues. And by the way, in Babylon, we never really lost a client. All our clients always stayed with us. We gave 1 or 2 contracts back, and Roy, you were not happy with one of the contracts we gave back. But the story behind that was sometimes our clients just didn't have the money. And we agreed that it's better if we don't deliver the service with them. But all our clients were still there, incredibly supportive, incredibly helpful. And we just talked about how do we redo this. But I ask a different question this time, which is, what is the biggest problem you have? Not what is the solution we got. And almost invariably, everybody came up, well, the most of the answer you get is workforce. Most people tell you, I just don't have enough people to do the work. Now, if you sit back and you think about why is everybody telling you this, that's because the problem, if the problem is the same in Japan and New Jersey, if the same in Africa and Scandinavia, then that cannot be incidental. There is almost no other industry. If I go to agriculture and I go to India, nobody will tell me I have shortage of workforce in the way that they will tell me in Colombia, right? Oh, sorry, I'm talking Colombia, New York, in United States. And so if that's the problem and it's structural, then what's the root cause of that structural problem? And that root cause is that there is a structural imbalance in supply and demand in healthcare. And rule number one of economy is supply and demand, right? During COVID, some people went and rushed and bought the toilet papers, and the most commodity item on the planet became a rarity. People were fighting each other over toilet papers, prices were jacking up. Now we have a problem where in healthcare, demand is completely elastic. When my child is ill, I will spend any amount of time, money, effort to fix that problem. Supply, on the other hand, is completely constrained. It takes a long time to create a Shafi. And our universities are constrained by input. There is not more universities being planned, it's not being created. That problem is not going to go away in any shape or form. By the way, all the hype about AI, I'm too old to believe everything I read. I've been there, done that, believed it, figured out what works, what doesn't work. But I do believe that AI now has not the ability to do the job, but is starting to have the ability to do tasks. And if you can orchestrate enough tasks, you can do a process, and you can supervise a series of processes together with humans to get a job done. That is a game changer. Because if you could get elastic supply to meet elastic demand in healthcare, you can fundamentally change the root base of the problem in healthcare, and that is worth getting up for in the morning. And then, Shafi, tell me whenever I'm talking too much.
No, I'm just listening. I'm happy to listen for a second. But let's just go. So that's fine. So you've got the workforce is a problem. We know that globally. If you go back to the WHO from 2015, their kind of work suggested that by 2030 would be about 15 million health workers short, but it's a shortfall. It's more like 20, 30 million. We know that. Healthcare workers are leaving in their droves. 40% of junior doctors, medical students want to leave the profession or go somewhere else, etc. It's a difficult position to be in. We know that. The UK, for example, we have 1.2 million workers in the NHS. We have 120,000 vacancies. That's 10%, of which about 40 to 50,000 are nurses, another 15, 20,000 doctors. So this is a real problem that we're facing. AI, of course, is now coming. LLMs are in. It's changing the kind of the conversation that we're having. Do you think, now that you're doing the AI, and tell us more about Q and what you're doing with Q, and do you think from Babylon, when you were first starting, and the intention was building an AI platform, that it was just too early? We weren't ready. The technology wasn't kind of sophisticated enough, and now in a position where those ideas you had 10, 15 years ago are now being able to be established.
So, look, tech gets better and better. And by the way, in Babylon, AI helped us a lot. People forget, when we were running Babylon, you could make a GP appointment at the time that average GP waiting time was 2 weeks and see a GP within 2 hours. And what happens when that happens? People don't use a GP once a year. It doesn't even matter if they're 39 years of age, which was our average age group. they use it 6, 7, 8 times a year because the barrier to entry is super simple, right? The smallest problem, I mean, my own son was using us 9 times a year, right? We're getting paid because of the average age, £80 per person. And we're delivering 6 consultations, 7 consultations in average a year. That's a near impossibility to do the maths, right? So we're losing money on every person. By the end, we were breaking even. So we were delivering 6 consultations one way or another and having many, many touch points, but we would be near enough breaking even in this. That is what technology did. That's all the efficiencies and capabilities AI did for us. Not just AI, all sorts of automated technologies, automation did for us. So, but it just wasn't where it is today. And I guess what? Wherever it's AI today, in 2 years' time, we will look at it today and say, that's just a joke, right? But it doesn't mean that we sit back and we don't do anything for the next 2 to 3 years and wait just for the technology to get better. Because if all of us did nothing, then the providers and suppliers of those technology have no market by which they can build that business too. So
tell us about Q. You've just launched in beta version a few weeks ago. So declare conflict of interest. Ali came to me a few months ago and said, could I be chair of clinical board? And we built a board together to help support the governance around building an AI product that was safe and efficient for patient use and for clinician use. And I'm proud to do that. Tell us about Q.
So so we basically think that if the workforce is a real challenge, and we can figure out how to do that work together with technology a lot more efficiently, then why don't we do that with people? And I don't believe, by the way, that AI is ready to do a job. And I don't believe that the population as a whole, most doctors, clinicians, physicians, hospital organizers, are ready to give their job to AI. I also don't believe the biggest problem in healthcare is administration. I know that many are focusing on administration, and I know that many of you look at the work you do as clinicians on administration, and you would say, this is a huge burden, I wish I wasn't doing it. I get it, it helps your life, and it's super important to you. But administration at most is 30 to 40% of the work anybody does. And if you take all of that away and let hospitals do all of that does by AI, that's a 30% improvement in productivity. The global healthcare imbalance is not short of 30% supply. Is short of 300% supply. 50% of the world population has no access, none, zero to healthcare. And even if your GP surgery hospital can do 30% more, your waiting time is not going to go from 2 weeks to 2 hours, right? So we are super focused at not doing the easy stuff. By the way, I think giant companies will do that and they will always be kind of, that's the easiest stuff. I think for us is, how can we look at hospitals, look at providers, look at GP surgeries, and say, what is it that you cannot do or you're short of? And you outsource it to us, and we will do that for you. We will deploy doctors, but we will deploy nurses of our own, but we will also deploy AI, and we will try to bring the balance of that cost so low that you could get that done by us at significantly lower prices that you would do it for yourselves. Because I don't believe, and I was just telling my friend Tal, that I'm not sure that's going to be our business model because we're trying to figure out our business model. And I hadn't told that to that many people before, how we're going to do it. But Shafi told me, if you're talking to me, you have to tell me something new. So this is the new, this is our business model. And I wasn't sure it's going to work until I talked to Tal, and he said, I'll buy it today. So he's my first customer. but that's, I think, what we're going to do. We're going to be an outsourcing partner that provides resource at massive scale globally, if we can, to those who need resources.
Thank you. And as a clinician, and I've tested out Ali's platform, and it's fantastic. It really is. It works. It delivers what it promises, and it helps me as a clinician. So, for example, if you look at the patient journey, from taking history, from registering on the EHR, then seeing a doctor, for me, offering an operation maybe, or diagnostics, then offering an operation, a consent, and a post-op follow-up. All of those touch points are kind of incongruent. They occur at certain points. What we're trying to do is make it a continuous deployment, so you have the touch points on a continuous basis. Patients deserve to be able to access healthcare every day, 24 hours a day. And I think that's where AI will help us, rather than those single touch points that we see them in clinic. Even then, at the moment, waiting lists are huge. For example, in my clinic only last week, patients were seeing me after 18 months on the waiting list. Someone forgot why they're seeing me, which was interesting conversation. Not surprisingly, it's been 18 months since they were referred. These things can't carry on. We can't carry on the healthcare system that's kind of broken, systems are failing with delays, etc. It's not fair for patients. We have to think and remodel healthcare going forward. Well, like about Ali and what he's done all his career is disrupt. Disrupt conventional thinking, what can be achieved by using simple technology sometimes. Sometimes approaching the hard tasks. Some of us are scared to approach the hard subjects, the hard topics, the things that might be difficult for society. But actually, Ali has challenged those with Circle Health, with Babylon, and now, of course, with Q. So I'd like to thank Ali for sharing his personal story. I've really enjoyed hearing about your life story. Also about the future of AI, and also where Q might sit, and where that business model might be able to bring back some reimbursement in due course. AI is new. We don't know what's going to happen in the future. We should be wary. We should put safeguards around it, ensure as clinicians and healthcare workers, we manage that whole future. We need to embrace it. It's coming. The genie's out of the bottle. It's a question of how do we use it effectively? How do we use it safely? How do people like Ali get support from us clinicians and the system to support them do the work that they're doing, what they're building? So, Ali, thank you so much. Round of applause for Ali. Thank you.
Thank you very much. And that's just the warm-up act for the main event coming up. Thank you guys so much. That was incredible insights into trying to make a difference in healthcare. Now, can I get our panel to come up here? Because actually what we'll try to do is we'll put together some of the themes that you've identified earlier and try to look at how we can incorporate some of that into the real world. So, welcome. Oh my God, this is like, we were supposed to have a little panel discussion beforehand, but we can have it here, can't we? We'll be fine. Right, have we got enough chairs? One more, or I can stand over them if you want, you know, make me feel slightly more important. More productive. So this next one will change your lives, won't it, Charlotte? Yeah. So it's so everyone talks about productivity and innovation and all of this culture stuff, but what does it actually mean? So we've managed to get some amazing people who are going to share their little views on what that means. But in this session, you've been incredibly quiet, and that's very nice. That's sometimes just the way we like it, isn't it? But to this session, we'd like you to ask questions and kind of, and it's not a pat on the back and stuff and say you're better than, you're ever so lovely, Chris.